Good day, we are the group 4. We're going to demonstrate the assessing of oxygen saturation. The purpose of this procedure is to estimate the arterial blood oxygen saturation of a patient and to detect the presence of hypoxemia before visible signs develop. So first, for the assessment part, we need to assess the best location for a pulse oximeter sensor based on client's age and physical condition. Unless contradicted, the finger is usually selected for adults. Second, the client's overall condition, including risk factors for development of hypoxemia. Example, respiratory or cardiac disease and hemoglobin level. So the third one, we also need to assess the vital signs, skin color, temperature, nail bed color, and tissue percussion for extremities as baseline data. And lastly, we also need to assess the adhesive allergy.
For the planning, most hospitals and clinics have pulse oximeters readily available for the use with other vital signs equipment. Other facilities have a limited supply oximeters. For the equipment, nail polish remover as needed, and pulse oximeter.
For implementation preparation, of course, we need to check the oximeter equipment if it is normally functioning. For our performance, of course, prior to performing the procedure, we need to introduce ourselves and verify the client's identity using agency protocol. Explain to the client what we are going to do, why is it necessary, and how to participate. We discuss how the results will be used in planning further care or treatments.
Hi, I'm Maricon, your nurse for today. Can I ask your name, please?
I'm Concepcion Bautista, ma'am.
Okay, and now I'm going to take your oxygen saturation. Is that okay with you, ma'am?
Yes, ma'am. Thank you.
Okay, thank you.
We also need to perform hand hygiene and observe appropriate infection prevention procedures. We also give and provide for client privacy.
We also choose a sensor that appropriate for the client's size and desired location. A pediatric sensor could be used for a small adult. If our client is allergic to adhesive, we use a clip or sensor without adhesive. And if we are using extremity, we apply the sensor only if the proximal pulse and capillary refill at the point closest to the site are present. And if our client has a low tissue perfusion during the peripheral vascular disease or therapy using vasoconstrictive medication, we use a nasal sensor or reflectance sensor on the forehead. We avoid using lower extremities that have compromised circulation and extremities that are used for infusion and other invasive monitoring. And then preparing the site. If visibly soiled, we clean the site before applying the sensor. So it may be necessary to remove a female client's dark nail polish because nail polish may interfere with accurate measurements, although the data about this are inconsistent. Alternatively, position the sensor on the side of the finger rather than the perpendicular to the nail bed. And then we apply the sensor and connect it to the pulse oximeter. We make sure that the LED and photodetector are accurately aligned. That is, opposite each other on the either side of the finger, toe, nose, or earlobe. Many sensors have markings to facilitate correct alignment of the LEDs and photodetector. And then we set and turn on the alarm when using continuous monitoring. We check the preset alarm limits for high and low oxygen saturation and high and low pulse rates. Change these alarm limits according to the agency policy. And ensure that the audio and visual alarms are on before you leave the client. We also ensure client safety by inspecting and changing the location of adhesive toe or finger sensory every 4 hours and spring tension sensory every 2 hours. We also inspect the sensor site tissues for irritation from adhesive sensors. We also ensure the accuracy of measurement by minimizing motion artifacts by using adhesive sensor, changing the sensor location, or immobilizing the client's monitoring site if absolutely necessary. To compare the pulse rate indicated by the oximeter to the radial pulse periodically, because a large discrepancy between two values may indicate oximeter malfunction. Lastly, we also need to document the oxygen saturation on the appropriate record at designated intervals.